and welcome back to the Physio World. Today I'll be discussing about a condition named Carpal Tunnel Syndrome. What is it? It is a condition that causes numbness, tingling or weakness in your hands. It happens because of a pressure on your median nerve that passes along your arm and goes through your wrist into your hands. In your wrist, there is a tunnel, carpal tunnel. There is a structure named carpal tunnel. It's a band-like structure, and when there's injury or compression on this carpal tunnel, it causes pressure or irritation on the median nerve that goes underneath the carpal tunnel. I have shown in the picture, and this causes these symptoms. And so this condition is also known as median nerve compression syndrome. Moving on to the symptoms include burning sensation, tingling, numbness, weakness in your hand, trouble holding things due to the weakness, shock-like feelings in your fingers, and so on. At night, you may feel your fingers have fallen asleep. Your fingers becomes numb. And at morning, when you wake up, you may feel numbness and tingling all over your hands, and it may radiate to your elbows. At the earliest stages of this condition, you may feel better while shaking off your hands. But at the later stages, it may decrease your grip strength and it may cause muscle cramps and pain. Moving on to the causes, the major cause is due to repetitive movements of your wrist. For example, while driving a scooter, while typing, and so on. The second cause may be wrist fracture, and the third cause is rheumatoid arthritis. They experience swelling around the joints, which may result in carpal tunnel syndrome. Next, let's talk about the risk factors who are more prone to this disease. Okay, anatomically, when you look at the carpal tunnel, the structure, females have smaller carpal tunnel than men, and so females are more prone to have this condition. The second one is those who have undergone any wrist fractures or dislocations, so are more prone to have this condition. And also those who have a job in which they make repetitive movements with your wrist and hands. For example, sewers or knitters, cashiers, musicians, hairstylists, bakers, and so on. Moving on to the diagnosis, we usually rule out this condition by doing some special tests like Fallon's test, carpal compression test, and many more. One of the tests is to give compression around your wrist for 30 seconds, and if the symptoms trigger, the test is positive. And there are many other special tests. And other than that, you can find out this condition by doing ultrasounds, MRI, nerve conduction studies, and so on. Now let's talk about the treatment. The first and foremost treatment is lifestyle modification. If repetitive movements is causing this pain, then it's better you take some breaks during the activity, or you can decrease the time of doing the activity. Moving on to the second treatment, it's exercises and stretches. There are some stretches and exercises which I'll be discussing in my coming videos. The third one is to use night splint. For those who experience increased numbness, it's better you put a night splint while sleeping, which gives you a great relief. Next, let's talk about the complications and prevention of this condition. The earlier you diagnose this condition, the better and the simpler it is to treat it. So if you experience any numbness or any of these symptoms, it's better you consult a doctor or a physiotherapist as early as possible. Some of the preventive tips are to keep your wrists straight, take breaks when required, and keep your hands warm. So hope you found this video informative. If so, do like, share, and subscribe my channel. Until then, stay fit, stay healthy. Thank you.